The agenda, we're going to be talking about the medical plans, the wellness program, dental program, SLEOLA, and the subsidized health benefits for certain contractual employees. All right, we'll talk briefly about what that's going to mean and then how that's going to tie into where you work, what agency you work for. So we're going to just kind of do an overview of that to at least point you in the right direction. Okay? All right, the times are changing. Oh, by the way, I don't read every line that's on these slides. And if that disappoints you, I'm sorry. Okay? New medical and dental contracts beginning January 1st. Okay? No more point-of-service medical plans. So if you currently have a point-of-service medical plan, you'll have to make a choice to pick one of the other programs that will be available to you in January of 15, or else you will have no medical coverage for 2015. Aetna will no longer be available. The reason it's listed separately, Aetna had a point of service and they had an EPO. The reason Aetna was listed separately because with the EPO, if folks just said, oh, there's not going to be a point of service, people might have overlooked the point that Aetna itself will no longer be available. Therefore, they could still stay in that EPO. That's not the case. Behavioral health services, okay, are covered in January, starting January 15, under your medical plan, as opposed to going through APS or third-party managed through your medical plan as it is now. Depending on the type of medical plan you have, starting January, everything will be under your medical plan. As a result, there may be some disruption in coverage because your medical plan network, the behavioral health providers, may not be part of that network. So you need to start checking on that. Many people have gotten communication from their plans about it as well to help with the transition come January of 15. The intent is not to arbitrarily just cut people out of getting services as of January. There'll be a transition period into 2015 to help with that. Kaiser is being added back as one of the state's plans. Kaiser is known as an IHM, an integrated health model. You have to use their facilities to obtain services. As an integrated health model, you have to use their group centers to receive services and or to be referred to other centers for those services you'll receive from Kaiser. All right? It's a local network. It's not available, Kaiser plan, not available to Medicare retirees. So if you're a retiree getting ready to be in Medicare or are in Medicare as a retiree, you're not going to be eligible to do the Kaiser program. United Concordia DHMO is being eliminated, not United Concordia. A lot of people have thought that when they hear, oh, United Concordia DHMO, it means all of United Concordia. No. The PPO plan will remain. The HMO will disappear. And if you have the HMO, you'll have to look at, if you want dental coverage in 2015, have to look at one of the other plans, either the DPO, the PPO with United Concordia, or the new vendor with Delta Dental DHMO. And again, SLEOLA doesn't apply, so we're not going to talk about that. Domestic partner coverage ends as of December 31st, officially as of January 1st. If that situation applies to you, you've probably gotten other communication during this year. But what it means is domestic partners who are now eligible for coverage will cease to have that eligibility as of January 1st. Since now in the state of Maryland, they recognize same-sex marriage so that those individuals can get married and still have the coverage. But if they don't get married, they will not be eligible for coverage any longer. 5 medical plans. CareFirst is going to have EPO, PPO, Kaiser, United Healthcare EPO and PPO. Behavioral health, again, added back. It'll be under your medical plan. Now, the chart, this is just a real thumbnail of the benefit comparison for the plans in 2015. In the books, there's more detail. The two things that I want to point out, the first is under the IHM with Kaiser, the $15 copays for Kaiser, both primary and specialist. Not 15 and 30 like it is with the other plans, 15 and 15. The other, if you look under EPO, the third category down, the annual out-of-pocket max copay, in 2015 it'll be $1,500 and $3,000. This year it's $1,000 and $2,000. So that's going up. But those are the only major changes listed on this chart when you compare to the current coverages that you have. GID coverage will be added starting January. Gender identification dysphoria. If you were involved with that situation, you would know, and you would then also be aware that it is going to be added so you could have services related to that. Acute inpatient rehab for stroke and brain injury. Hopefully none of you have been exposed to this in the past, but if you had, or at least been aware, there had been limitations in the medical plan with the state for this type of service in the past. Starting in January 15, it will be covered. And again, your book has more detail, and if you're concerned about it, check directly with your health plans. Mental health parity, residential treatment centers are going to be covered, and services that you receive or supplies under mental health or behavioral health services will be covered. Okay, you'll still have coverage, even though, let's put it this way, there might be a difference in opinion between you and the treating provider about what type of treatment plan is best for you. Currently, if a person disputes what their treatment plan is and doesn't follow it, technically they don't have any coverage. Okay, that can be canceled. Not the whole coverage, but that particular aspect, the coverage can be denied from that point forward. But starting in 15, that will no longer be the case. Gives a little bit more flexibility, I guess, in the total sense of it. You know, if you haven't heard already, if you haven't seen, the rates for medical in 2015 have not changed. The rates for prescription have gone up 6 to 7%, depending on the level of coverage you have. All right, the PPO dental rate did not go up. The HMO dental rate, if you take Delta Dental, which will be the HMO provider in 2015, the actual rates, the premiums for that, are less than the current United Concordia HMO. Okay? So basically, I just want to address that. It's not as much of an issue now because people have their material, but early on when we were doing these, people had heard all these things about rates were going up 10% and da-da-da. No. The wellness program basically has been identified in conjunction with the medical plans. The state's been working on this for a while to basically get in line with many employers around the country, whether it be private institutions of educational institutions, private employers, large companies, et cetera, to do a wellness program to hopefully keep people healthy and to get folks healthy. State employees, quote, quote, and their spouses. The wellness program does not include under its coverage any of our dependents, children, stepchildren, such. It's strictly ourselves as a retiree, conceivably, and our spouses as an active employee and our spouse. And if you're part of a medical plan with the state, the wellness program basically is going to be involved. Okay? You can't say, oh, I don't want to participate with wellness. It's not a separate involvement unless you don't have medical coverage, and then the wellness program will not apply. The reason the state and the plans have worked on this, non-compliance as far as people not getting treatment for services and conditions they have, there's a lot of increases in those types of services. Large claims, end-stage renal disease, there's an increase in those type of costs, ER costs. The majority of the population is not receiving the age-appropriate screenings for colorectal cancer, breast cancer, etc. The population is aging. Overall, the state employee population, it's not as healthy as folks expect it to be or want it to be. Over $250 million were spent in fiscal year 12 for diabetes, heart disease, and hypertension. I'm not going to read all of them. 51,000 patients with hypertension, 33,000 patients with diabetes. All right. There's a lot of need out there. And this program is set up and designed that as the years go by, hopefully, state population will become healthier. And that will result in lower costs for everybody. Because the trend is up and up with the costs for health insurance. And if this program can be half as successful as people expect it to be in the first few years, those costs can be brought down or at least balanced out, leveled off, so that there'll be a cost savings for everybody. The state in fiscal year 12 just for medical and prescription costs with chronic conditions, high blood pressure, heart disease, okay, diabetes, for instance. $722.6 million were expensed for the state population with those conditions in fiscal year 12. In fiscal year 13, the figure is $830 million. So it's going up, all right? The goal, as I mentioned, is to improve population, the health, the overall population's health. Flatten that trend line without cost shifting. So there's a variety of things out there which the state doesn't want to do. They don't want to get into this, negative, punitive aspect of things. That doesn't mean that there won't be goals that we'll have to work towards if we have chronic conditions. It doesn't mean that. But it means that it's not going to cost you your job, okay, like some folks have thought, if they don't, quote, lose the 20 pounds that my doc has said I need to lose, okay? Wellness and personal responsibility, that's what it boils down to. Focus on the plans to help give incentives, okay, that the quality of care is provided is the best possible and that those outcomes are also satisfactory. And then just the participant awareness of differences in the costs. So you're aware. One of the aspects of the wellness program, which a lot of people may not be that familiar with, but starting in 2015, all lab and x-ray is going to be covered with no copay or coinsurance in network. Now, if you're in a PPO plan and choose to use a non-network provider, this will not apply, okay? But if you're using network providers, lab and x-ray, no copays or coinsurance. And as you know now, the PPO, you may have 90% for those services. Starting next year, it'll be no copays and covered in full. Copays for primary visits waived once your risk assessment is performed, and that's part of the criteria we're going to get to in a couple of minutes about the wellness program. And then the continued waiving of the drug copays for those generics that are prescribed to treat certain chronic conditions. Not every generic is a waiver on the copay. There are certain ones, and they're in your book, okay? Or you can find out directly from Express Scripts if you have any questions about that. But that is in effect now and will continue. There'll be programs available, resources available to the population for weight management, nutrition education, tobacco cessation, no cost to the individual. The costs are going to be borne by the plan and the plan's input. Online resources that you'll be able to compare prices. Not that you're just going to shop because the doctor's price is less, but at least you're aware of what these costs are. Online tools for members, again, to help with the pricing. And then additional health fairs and other activities that'll be offered throughout the state in conjunction with what your employer might do as well. This is not taking away what your employer can do to help keep their population healthy. It'll add to that statewide. Okay, one of the main differences in the material you have printed, that you might have the handouts or whatever you might have seen or received to date, first and foremost, the wellness program does not apply to Medicare retirees. So if you're a Medicare retiree, you could still do the program to help yourself be healthy, but you don't have to do it. Okay? So first off, now I'm a retiree. I know, I retired earlier this year from another state institution, which I won't name at this point, okay? And I'm not 65 yet, so I am going to be subject to the wellness program. And my spouse, who's not 65 either, okay, with Medicare, will be subject to it. Because I don't personally plan on dropping my medical plan, for 2015. The two things I'm going to have to do, and if you all don't mind, I'm just going to focus on me. The two things I'm going to have to do, starting in January, first is to go on my health plan website, because there'll be a lot of information on that site for you, and it'll only be your site. Nobody else will have access to it, all right? But that's where I will go and get this health risk assessment, and I'll complete it. It may take 10 to 30 minutes, depending on how quick I am with it. Then that stays with my health plan. I will get a report back from my health plan after they've evaluated it, And that report is what I will take to my primary care doctor. Okay? When I meet with that doctor and review it, there'll be a portion on that form that will be the sign-off. The doctor will sign off, and either the doctor will send it back to my health plan, not the whole report, but just the sign-off, or I'll do it. Okay? The health plan will then list that Dave Curtis has met those two requirements. And so, once that's recorded in the health plan data for my record, from that point when it gets recorded forward for the remainder of 2015, I will pay no more copays whenever I see a primary care provider, whether I'm sick or I just want to go in and get a checkup again because I haven't had one for a while. The $15 copays will be waived for me. My wife does it, same with her. If I don't do it, I have until September 30th to do that. If I don't do it, then here's where it starts. In 2016, as a retiree, I'll have a total $50 over the year prorated out of each of my retirement checks. If you're an active employee and you don't meet that requirement, the healthy activity things, starting in 2016, out of every paycheck that has deductions for health care, you'll have a deduction for that surcharge. Works out about $2.08 a paycheck, assuming 24 pays. If I don't do it, I'm going to have a $50. If my wife doesn't do it, out of my retirement check, there'll be $100 spread out over the year. If your spouse doesn't do it, you don't do it, then it'll be $4.16, give or take. That's how that surcharge will work. That's what the surcharge is in 2016. It won't happen in 2015. The activity has to be done in 2015. Now, a lot of times people say when they got to this point when we've been talking, they say, well, Dave, that's great. I have no problem. I see my doctor enough anyway, But it takes 3 months to get an appointment with my doctor. What do I do? Because I'd like to not have copays. Start now to try to arrange an appointment with your doctor in early 2015. I have an appointment with my doc in 2 weeks. I'm going to go, and when I talk to her, I'm going to go through A, all this to make sure that she's clear, and then B, say, okay, when can we get together? January, February, snow notwithstanding, but and go through this thing because I plan to get that assessment as quickly as I can, get it done, out of the way. So it's going to be on you to be more involved with your doctor. I had a person in one of the meetings we did last week, I believe it was, who basically said, well, I've never seen my doctor. I don't even know who my doctor was. I think I had identified a few years ago, but I don't go to the doctor. I'm healthy. Cool, great, excellent. But this is going to, and it's not forcing. If you don't do it, you will have that $50 subsidy, surcharge in 2016 to hopefully head off any issues that might be developing that you don't even know about, okay? But if you're now dealing with your doctor on a fairly regular basis, hopefully you know what I mean, it's not going to be that much of a difference other than doing the assessment each year and then having that sign off, because it has to be done each year unless, like me, you're identified with a chronic medical issue. And then there's different criteria that I'll have to meet after 2016, okay? You have to wait until January because the assessment will not be available, the tool will not be available to us until January. All the plans will have it on their website. If, for whatever reason, you don't want to do the website, that's fine. Contact your plan, and they will be sending you a blank that you fill out, and then there will be a self-addressed envelope. You send it back to your plan, and then it'll get recorded once you have gotten your report and talked to your doc. One other thing I'm going to mention, because it hasn't come up, and I'm sure it's in a lot of people's heads. The state benefits office, DBM, all that, does not get this information. The only thing they're going to get, which they get now, are aggregate data on state employees, retirees, what type of, office visit utilization, stuff like that. It's aggregate. It's not Dave Curtis has gone to the doctor 3 times in 2014, Same thing. When I do my report, meet with my doctor, and she signs off, then my plan will say Dave met his requirement. And then when that next feed, because I don't know what the schedule is going to be, you know, every 2 weeks, whatever it might be, but when that goes to the state benefits office, it's just going to say, because it will identify Dave and just say that he did it. That's all it's going to say. Not anything else about, well, what did they find and all that bit. Does this apply to Medicare eligible retirees? And the answer is no. If you're a retiree with Medicare, it does not apply. If a non-Medicare retiree in 2015 doesn't complete the requirements for the 2 healthy activities, but they are Medicare eligible in 2016, remember, the surcharge applies the year after for the prior year's, you know, either success or not as far as meeting that criteria. So yeah, you would still be charged because it was for the 2015 year that you should have done it. Now, in year 2016, the risk assessment again, review with your PCP. Then, depending on the results of that risk assessment from the prior year and that year, if you have a chronic condition that needs to be addressed, there'll be certain preventive services that you'll have to meet, some screenings or whatever it might be. The one that's come up a lot, and I'm not sure why, well, I do, colonoscopies, okay? This program's not going to say, again, I'll pick on me, Dave, you have to have a colonoscopy every year. Now, I have to have one more frequently than many people because of my family background. But it's not going to force me to have a screening if it doesn't fit into what my doctor and I have gone through with my own health situation. Then in 2016, I'm going to have to participate in the disease management, which basically is no different than my doc saying, you need to take your blood pressure medicine. Okay, how's that going? You need to lose that 20 pounds. Some people would say 30, you know, depending on the BM, you know, and all that. But the whole point is I have to participate. Key word. It doesn't mean I have to lose the 20 pounds by a certain date to pass, okay? It means that I have to be participating. And my doctor, when we have that review, you know, are you participating with this stuff? Here's the things we're going to do. If that's fine. Then there's going to be from the medical plan, okay, health managers who will be contacting me depending on the nature of my chronic condition and following up with me during the year. Has anybody ever had a call from one of the health plans if you've had a major issue? Okay? If you've had it, that's going to be a similar type of approach, but more concentrated to help address the follow-up. And those calls, many of those calls, will be coming from your doctor's office because those folks, many of them, will actually be in your doctor's offices working with your doctor to help with this. Okay? So the key is the follow-up. If I'm participating, I'll be fine. Okay? And again, the PCP copays, but it's going to increase to $75 if I don't do it, starting in 2017. Remember about the surcharge. The surcharge would apply if on the prior year you didn't meet those criteria. If I didn't meet the criteria in 2015 and I get a surcharge starting in January of 16, okay? If I meet the criteria in January of 16, I've done it. They're not going to come back and stop the surcharge because that surcharge was because I didn't do it in 2015, okay? So again, getting back about meeting with your doctor, if you think it's going to be an issue on timing to get with the doc, start trying to get those appointments scheduled now if you can. But the assessment tool, the actual health risk assessment, will not be available to us until January. And it will be on the website of our medical plan. When you're talking to your doctors now, talk to them about this, ask them about it, because the plans are communicating with their providers. And many of the plans have similar programs that they deal with in other employers, and they have the same network of docs. So it's probably, in many cases, not going to be anything really different for the doc other than, oh, now you're involved with this thing as opposed to not being involved. There's not a point where it says, Dave, if you didn't lose that 20 pounds by, and I want to pick an arbitrary date, birthday in February 2018, we're going to increase your premium for health insurance or worse, change your plan totally. There's no plan to do anything like that. But, well, okay, yeah, but if I haven't done enough and or shown that I've been doing anything, then I'll be paying surcharge. And the surcharge for folks with chronic conditions don't just go $50, $75. It can go up to $250, $325 in future years if you are not participating with the program that you and your doctor have worked out. If an insurer, if a member doesn't want to get a particular screening that's identified as recommended, but if you personally don't want to do it, there will be a provision that you can appeal and say, look, here's why I don't want to do this. I'm not going to stand here and for posterity tape that, oh, well, that'll be accepted, no worries. You can do that, all right? But see, again, that gets back to the reasonings why a person may not want to do it. There could be religious grounds, and there is going to be an appeal process. It's being fine-tuned, okay, to apply for that, to say, look, these are the reasons I don't want to have to do that. There's an individual, and again, this is, who is smoking and doesn't even want to try to quit. Right. And that individual has already basically said, I'll pay the surcharge. Right. I'm not going to even try. Because in smoking, that's a pretty sensitive one. Doesn't mean I have to stop smoking by a certain time. You have to try, and I think it's 3 times minimally as the years go on, to try to quit. If you were identified, and I'll just say that, if you were identified for certain screenings that had to be done and you said, no, I don't want to do them, unless the appeal accepted what the grounds where your request was, then you could be subject to the surcharge. All the pages, all the information you read about what the risk assessment time frame, what the surcharges could be if you don't comply with those, only apply to non-Medicare retirees and active employees and those spouses. The chart's going through 2020. And again, the time frame, again, reminder, 2015, you have until September 30th. Obviously, if you wait till September, and by the time it gets logged into your health plan, there may only be a month or 2 left in the year that you would be able to enjoy no copays for any primary care visits. So that's why I try to get it done as soon as you can. Primary care is considered internist, family practice, OB, OBGYN, GYN, PAs, and nurse practitioners. Any of those individuals would be identified or could be identified as PCP. It's not primary care MD, okay? Again, we were talking about the surcharges. $50 per premium surcharge for healthy people, which I'm not in that category, who fail to complete their activity requirements. That starts in 2016. If that individual also refuses to do it, doesn't want to do it, whatever, in 2016, it will increase to $75 in 2017. Any on these slides where it says retiree, it would be a non-Medicare retiree. $250 premium surcharge for individuals identified for disease management, again me, who fail or refuse to engage in treatment. That's starting in 16. And then in 2018, it goes to $375. That's for if you're a chronic medical disease management issues and you're not following up with anything on those conditions. There is alternative activities available if you can't complete some of those activities. And there is, as I mentioned, the question about the appeals process, which the details of that are not yet finalized. They are going to be coming out, and I expect they'll be available to us before the end of the year, or at least as of January 1st. If the individual has the risk assessment and has disease issue, chronic conditions, when will that management with the disease management program that you'd have to follow those guidelines kick in? It won't be for subsequent years, starting 16 or beyond. But in 2015, for anybody who's subject to this, 2015, the only thing anybody, disease management or not, the assessment, the review with the doc, and then that confirmation back to your health plan. That's it. Basically what will happen is this. Once you've met with your doc and the doc has signed off on the report that you deal, right, and then that communication goes back to your health plan, whether it be from your doctor or from you. Then when the plan sets you up and says, okay, Dave has met that requirement, okay, the expectation is that your plan will show on that internal website page for me, for my account, that I have met my requirement. So I'll know that it's recorded. Also, and this is kind of jumping ahead a little bit, but allow me, new medical cards, new dental cards for 2015. There's been some talk that some of the cards, or the cards, may show zero copay for primary as a way of your medical office to making sure, okay, what your status is. Because remember, once Dave is showing in my record with my health plan has met the requirement, my doctor's office can accesses my plan's site to see what's my status. And it will show met requirement, no copay. So they're not going to charge me a copay even though I'm not supposed to pay. And I know nobody's ever been charged a copay that you haven't been required to pay, right? I mean, it happens. You know, you just have to be vigilant about it. But once that gets set up, there shouldn't be any issues with that. Now, it may take some time to get everything smooth, but it's working toward that. That's why, again, I mentioned try to take some time with your doc between now and January, you know, to say, hey, you know, what have you been told? What do you know? Just to get prepared. Dental coverage, the plans again, dental PPO with United Concordia, the maximum, those of you who have the dental with United Concordia PPO, you know that there is that out-of-pocket max currently per member, $1,500. Next year, it's going to increase to $2,500. So there's more space that you can receive services before you get capped. Again, that's a bad pun, but you know. And that is, again, per member. Now, one other thing for remind, in 2015, that your annual, well, you can have twice in a year your routine exam and all that with the dental. It doesn't have to be every 6 months. I was clarified last week. But those costs for those routine preventive things don't go towards that cap. So they don't get added in to meet up to that $2,500 max that you'd be dealing with for 2015. Delta Dental DHMO. If you're familiar with the HMO with United Concordia, and if I say that, I'm not going to say they're the same because they're not, but it's very similar from the standpoint of a network of dentists that you have to select a provider, okay? You use that dentist to get your services, and then depending on the ADA code for the service, there's a fee that you pay for that service. There's no capping, meaning from the standpoint, I shouldn't say it then again because that might be confusing for dental. There's no max, you know, under that plan. If you end up getting 4 root canals, you're going to pay whatever that root canal fee would be for 4 times, okay? There's none of this. Once it gets to a point, you will have no benefit. But you have to use the network dentist. One other difference between Delta Dental's HMO and United Concordia's is United Concordia's dental HMO was just a regional network. If you moved out of the area, it's not going to do you any good, all right? Delta has a national network. So it's more likely that if you move out of the area, okay, that the Delta Dental HMO could help you and give you services in other areas of the country. October 15th to the 14th. I'm not telling you anything you don't already know. Hopefully you already received these dates. But one thing I'm going to mention right now, and it's not really listed here, there's no correction period. Remember the correction periods that we've had? If you didn't do it by the deadline, quote, quote, oh my gosh, I forgot, there would be a period that you can go in and do something. Not this year. If you don't do it by the 14th of November, I would just tell you very politely, don't plan on getting those coverages that or whatever changes you want to make. You've missed the boat. No IVR. I know. Oh, usually people jump up and say, great. No, no, no. Everything's on paper this year. So, if you want to make a change, if you have point of service plans, obviously if you want medical, you're going to have to enroll in something with the state if you want the state plan. You'll have to fill out the hard copy form and get it to your agency based on their guidelines to you. I'm not going to stand here and say you have to have it to them by a certain date. They'll tell you that. And then that will be processed to make those changes. If you want to make a change, whether because your point of service plan is getting, dropped, or you just want to change, you want to try something different for next year, you fill out the form, name, address, all that stuff. And then you only fill out on the form what you want to change. You do not have to fill out everything. If you look at your booklet and your packet and see the summary of the coverages you have, yep, that's good. That's what I want. Nothing different. You don't have to do anything during open enrollment. If any of you have gotten your packets and opened them up and have either point of service plans or United Concordia HMO, when you looked at your summary, you had a couple of lines in red, and then it had a highlight on your summary chart of the plans that will not be available next year. That's your reminder, okay, that if you don't act, those coverages will not be available and you'll be out of luck for all of 2015. So follow those directions, fill out the form to select what you want if it's a change from what you currently have that will carry over. If you're doing flex spending, since those don't roll over, the only thing you do on that form, name, address, blah, blah, go to this flex spending, put in how much per paycheck you want to have come out, sign and date it, keep a copy for yourself, and get it to your agency coordinator. You will get a summary statement once the form's been processed. People have gotten those in the past, right? You'll get that. When you get it, like it is in every year when we've gotten those summaries, pay attention to it. Mistakes do happen. Look at it to get the corrections made, because if you don't look at it until January and say, daggone, I didn't do that, you might be, again, out of luck for the whole year. I'm not going to say definitely, because could be a reason for it, but you need to be very prompt and careful when you look on those summaries. Okay, again, the reminder, all point of service, you have to make a selection if you want health plans next year. All DHMO with United Concordia, again, if you want dental, you're going to have to select a dental plan. Any Aetna members with the EPO, if you want medical, you have to enroll. As I said earlier, new cards, everybody's going to get new cards. Domestic partner coverage is going to end. And the rates, this hasn't been updated, but we already talked about the rates didn't change for medical, and the slight change on the prescription, and a reduction in the overall rate for the dental HMO. Okay. Okay, now this applies to the contractual employees. All right. Long story short, 30 or more hours a week or 130 hours on average per month, contractual employees are going to be offered subsidized health benefits. The agency where that individual works has been communicating. There's been a lot of information being passed back and forth, but the agency and that employee will be responsible for the initial submission during open enrollment and then subsequent recertifications, if you will, that they meet those requirements. And what it'll mean for those individuals is that they will be billed like they normally would be billed as a contractual direct pay with the state now. They'd be billed, but they'll have a 75% subsidy for medical and a 75% subsidy for prescription for any level of coverage, employee, employee spouse, family, whatever. So their net that they would be paying the state on a monthly basis would be reduced because those subsidies will be already included in what they get charged. Okay? Now, if you're not a contractual employee, it doesn't apply. If you work with contractual employees, you may want to go through more details with your agency, how it's going to affect your contractuals. But that's basically going to be how it's going to shake down. Okay? I appreciate your time. Good luck. Thank you very much.